Thank you everyone for joining. This meeting will be recorded so that others who can't make it tonight can learn about this important resource. So I just wanted to let you know we will be recording. In case you haven't participated in NAMI programs before, this is our community resource night. It is an opportunity for any caregiver of someone with a mental health condition, but especially parents of youth and young adults, to learn about local resources that we have, how to access them, and just information about what kind of mental health support is out there in Santa Cruz. I will be putting a link in the chat to our family support groups. If you haven't participated in a NAMI family support group before, it's a really great way to get acquainted with the support that we offer families specifically. Our support groups are drop-in friendly, so you can join whenever you're available, and they are via Zoom. So I'm going to put that in the chat right now. And please feel free to check those out. All right, today we have a really great resource joining us. Please join me in welcoming Reina Valencia, Mental Health Liaison to the Watsonville Police Department, and Officer Trevor Island, who make up the Watsonville Police Department's CARE Team. And CARE is an acronym that stands for Crisis Assessment Response Engagement. And Reina and Officer Island will share more about what services this team offers and how to contact them. They'll also be available to answer any questions that you have. And in the interest of making sure that the presenters have all the time they need to share the information that they have, we ask that you hold your questions until the end. And you can ask your questions either in the chat or you can use the raised hand feature on Zoom and I will call on you. All right, thank you so much. And I will hand it off to you, Reina and Trevor.
Thank you so much for having us, first of all, NAMI, for reaching out and requesting that we participate in this today's evening and share the resources that we do offer here in South County. So again, my name is Reina Valencia and I'm the Santa Cruz County Mental Health Liaison to the Watsonville Police Department. I am employed through Santa Cruz County Mental Health Services, but I am specifically assigned to the Watsonville Police Department. And before I talk a little bit more, Officer Trevor Island, do you want to introduce yourself quickly?
Yes. I'm Officer Trevor Island. I've been with the Watsonville Police Department for 14 years now. I've held several assignments. Field training officer, detective, and most recently on the CARE team.
Thank you for your words. And both of us, we make the CARE team here at the Watsonville Police Department. Both of us are specifically paired up to respond to calls that come in through dispatch or 911. Involving individuals having a mental health crisis. And a lot of the calls that come in oftentimes are from the individuals themselves asking for help, or sometimes it's a family member, or sometimes even a provider. They happen to have a counselor assigned, doctors, all sorts, sometimes even from the schools if the person is still a minor and is in class and they express having a mental health crisis or feeling suicidal. We also get dispatched to calls of that sort. And again, my specialty is mental health. However, we do interact a lot with many other individuals having struggles with substance abuse, traumatic brain injuries, you name it, cognitive delays, cognitive disabilities, sometimes even with elderly individuals struggling with dementia, anything of that sort. And it's kind of our job to figure things out as to what's really the issue, what's the need for this person, and link them to the proper service. And to determine really if it's a mental health condition, to really assess to see if this person needs to be hospitalized psychiatrically, if they are at risk, or people around them is unsafe because of their mental health condition. Officer Inland, you want to add any more?
No, just my portion of it is to kind of bridge the gap between law enforcement and the mental health side, um, and help try and kind of go beyond just the call for service. Because when I first started, it was, are you a danger to yourself? Are you a danger to others? No. Okay. Gravely disabled? No. And we leave. And then hopefully never have to go back, or something worse happens. But now with Reina, we're able to kind of go a step further and do follow up and make sure that person gets the resources they need.
And then we also are a strong support to family members, relatives who are needing guidance, maybe some kind of resource to better support their loved one. I know I've referred so many families to NAMI in the past, and vice versa. I know NAMI have encouraged families to reach out to us as well. So just being a resource, providing that psychoeducation to a lot of family members who are really trying to be a support to their child, to their loved one. That's another role that we do carry on here and provide that level of support. I know we do just across the county. Currently, we have it's a total of 3 mental health liaisons who are paired up with law enforcement. We have one working with the Sheriff's Department and another one working with Santa Cruz Police Department. We are in the process of hiring more because we realize that there's a high need. But we also do have a crisis mobile response team through the county that provides similar services, crisis services, but without law enforcement. A lot of families, community has requested that the county provides crisis services, but not necessarily through law enforcement or with law enforcement. And that's something that the county's developing, and to be able to offer that service 24/7 if possible. Of course, we are going to need a lot of staffing for that, but we are in the process of expanding our hours for response as well. So that's just a little bit of extra information that I'm sure more is going to come within time, but that will be another option in the future as well. And I know a big question that does come up is how if I need a team to respond, what do I do? Where do I start? Where do I go? For us, I would say calling dispatch, and it's the non-emergency. If it's non-emergency, if it's something urgent, then you call 911. Once you talk to the dispatcher, the operator, then it's very important that you request the mental health unit to respond. They're going to know what is it that you're requesting. And whether if it's Officer Inland or myself, if it's in South County, if you live in South County, most likely it's going to be us. But if it's somewhere in Santa Cruz or in the Sheriff's Department's jurisdiction, even if you say the mental health unit, they will track the mental health liaison assigned to these law enforcement departments and link them to a deputy so that they can respond to where you're at. Officer Inland, you want to add anything else?
No, I don't know if I want to talk about the co-response kind of model. We're fortunate enough, supposed to be fortunate enough to respond together to all the mental health calls while we're in service. Other liaisons will go with whatever officer is being dispatched to that call. But me and Reina work together, and so we kind of know how each other work, and I think it's very valuable how Watsonville Police does it.
Yeah, thank you. Thank you for that. Not every law enforcement jurisdiction happens to have this model in place for many reasons. But here in South County, that happens to be the model that we've practiced ever since I started here, which that was about maybe 9 years ago. I've always been paired up with one specific officer who I get to work very closely with, and we kind of learn from each other. I gotten to learn a lot around law enforcement, and same for them. They've gotten to learn a lot about mental health stuff, clinical stuff, diagnosis, assessing, building rapport, providing that emotional, empathetic support. And I'm going to open it up for questions or scenarios if there's any. We have plenty of time, but I do feel that every case is different. Every need is different. And I am hoping that you guys have specific questions maybe that come to mind so that we can be of better use to all of you. I don't know if there's any questions out there, concerns, comments in general, specific scenarios. Jean?
I have a question. First, thank you both for your service. I have a relative with mental health issues, but in another county, so I'm not sure how this is going to fly. But I guess my question is, the person has paranoia, and so has been sort of what is it, abusing, reaching out to law enforcement, making accusations about blah 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 with neighbors, and I've experienced it with, he'll do something like, you haven't called me in 20 minutes, I'm going to call the sheriff, which he did once. So I've read him the riot act, say don't even think about doing that again. But is there any kind of I don't know, anything you could add with someone who's maybe abusing his contact with law enforcement?
Yeah, and I think we've come across situations like those, and I think we've tried both, where the department here, the Watsonville Police Department, has requested for me to reach out to the person to see if they're even willing and talking to me, because I do have to say that a lot of the times when the outstanding symptom is paranoia, they may not be fully in tune with their paranoia.
Right, exactly.
And when there's no sense of awareness, insight in their paranoia, they may not perceive their need as a mental health need.
Yeah, right, exactly.
So it doesn't always work if I reach out to the person with the purpose to provide support, maybe resources, maybe linkage for him or her to get the proper level of care. If when I call, I say, this is Reina and I'm a mental health provider. They may not be very receptive to that. Why? Because they don't perceive their need as a mental health in the first place.
Mm-hmm.
However, sometimes they are more open in speaking to an officer because, again, they're paranoid. They want that level of protection, sense of security, and a lot of people will believe that police is here to protect me, so I will talk to police versus a mental health worker.
Exactly.
And that's kind of where I come almost to a fault, very patient, so I'll hear someone out. And I'm not responsible for a beat, so I'm not having to go to the next call, next call, next call. So I have the ability to hear someone like that out, and I can think of a couple names that come to mind here, where it's very similar.
So other counties would have it, like I could look into the county where he is and maybe ask for similar kind of resources or something, maybe?
Yes, you can definitely reach out to either the law enforcement jurisdiction where he lives, or I mean, the secondary option would be reaching out to the mental health department where he lives. But again, if the outstanding symptom behavior is paranoia, then mental health may not, unfortunately, be the right avenue to reach out to him.
Let me ask one more thing. Is it possible ever just to say, don't respond to this person? I know that's probably not an option. I'm sure you respond to everything, but I guess any law enforcement would be familiar with him at some point and know what the story is, I'm guessing.
Well, I think that may vary depending on the size of the law enforcement department. If it's a fairly small police department, then most likely most officers will become familiar with those individuals. But if it's a pretty big department, then they may not fully know the history of this person. And I think that's where it becomes tricky for the officer as to how to best help and support the person. Does that make sense?
Yeah, it does a lot. Yeah, thank you both very much.
Yeah. So it's always helpful to have any extensive history. It's always helpful because again, the person with the mental health condition may not be fully forthcoming with their own history because again, to them, it's probably real. It's not a mental health issue. And then if again, if they're having paranoia, they may become very selective as to how much information they want to release because again, they don't want their information to be put out because then they might be even more at risk. I hope that makes sense. I know it can be sometimes confusing.
It does. Thank you. It makes exact sense. Yeah. I think he operates out of a lot of fear, and so that's why he reaches out.
Right. And oftentimes what they want is that level of reassurance. Like nobody's out to get you, you're safe, and you're going to be okay. From a clinical perspective, that would be the type of interaction reassurance that I would provide. However, would an officer be able to do that without really knowing the need, the clinical need that he's probably seeking without him verbalizing that because of his poor level of awareness and understanding?
You said the sheriff department here has a mental health person as well. Like if he contacts me again or something, is that someone I could contact to, talk about any of this with, or?
Yes, definitely. If does he live in the sheriff's department jurisdiction or in out of county?
Out of county.
Okay, yeah, you could definitely reach out to the mental health liaison with the sheriff's department more than anything for some kind of guidance.
Yeah.
In the event that you reach out to the city or county where he resides in.
Great, thank you so much.
Of course, yeah. And yeah, those can be tricky. And again, our intention is to help. We don't want to make it worse on them. So we have to be very cautious as to how we try to help.
I have a question. I am wondering what the difference is between the care team and a response team like MERT or MERTI and how caregivers might, decide who to call for, mental health support.
Yes, and that's a great question. So the difference is MERT/MERTI. It's also mental health providers, clinical staff employed through the county, but they respond without law enforcement. That's flat out, that's the main difference. Compared to the mental health liaisons, we always respond with a deputy or an officer, always law enforcement. And to determine who to call is based on the safety-ness in the call. So let's say you have a cousin who's struggling with a mental health condition and he is in access of a gun or a knife. the MRDI team may not be the best team to reach out to for support. It would be law enforcement. The reason why is because of the weapons and the knife. Another example, when to maybe consider MRDI would be a student at SoCal High feeling depressed, stating he wants to end his life and has a plan. No weapons, no, not under the influence of any drug, fairly cooperative, not being aggressive, just in need of that clinical support. Then MRDI would be the best option.
Thank you. And for those who don't know, I should have expanded. MERT is the Mobile Emergency Response Team, and MERT-E is Mobile Emergency Response Team for Youth. Thank you, Mina.
Yes, yeah. Hopefully that kind of explained the big difference between both.
It does.
Yeah, if there's no need for, the way I refer to it is, if there's no need to bring a gun to the picture, then there's no need. Because again, we don't want to make it even more traumatizing to the person, because we realize that interacting with law enforcement can be very traumatic. And the purpose is to help, not to make it even more traumatic to that person.
I have a question, Raina.
Yes, of course.
So for a person who's in their home and not a danger and has no weapon, is MRDI or MERT available to go to their home or talk on the phone to someone who's hearing voices that are making her feel suicidal?
Yes.
They only available 9 to 5?
They have changed the hours of response, and now is all week, Monday through Sunday, from 8 to 6 p.m.
Okay.
If it's after 6 p.m., we do have other crisis staff who will respond as well,
Without law enforcement?
without law enforcement, if it's safe for them to respond.
Okay.
Yes.
And at what point do you think somebody should be calling 988?
I would say at any point that you feel you need more support than what you can offer that person. Let's say it's a parent and your child is having a crisis and you've tried everything and you're just not, things are just not getting any better. At that point, I would highly encourage you call.
I think the 988 is relatively new, but I think people need reassurance that it's not going to lead to involuntary hospitalization when they're honest about hearing voices that are talking about suicide. So when I was suggesting this to someone, have you tried 988? She was, no, I'm scared to call them because they might call for me to be hospitalized, and I don't want to be involuntarily hospitalized. So that's a problem about, well, it's just, I guess people need to know how 988 really works. Because it's amazing that anyone could call. I saw they had 8,000 calls in our county. That's a lot of people being helped, but we got to spread the word that you don't need to be afraid to call 988.
Right. And the main purpose is for the community or that individual to get the proper support that they need. Us as clinicians, our goal is not to hospitalize anybody. That should be the very last option, if absolutely necessary, to keep that person safe. But if it's someone who's presenting symptomatic, having delusions or feeling suicidal but with no plan, I don't think that it's equivalent to an automatic 5150 or inpatient. I think it's common within many people who do have a mental health condition that they experience suicidal ideation, but not necessarily with a plan or
Yeah.
means to act in the plan, if that makes sense.
Yeah. Yeah. So do you guys refer people to 988 just so someone they could chat with any time of day?
Yes. Yes. And then the other thing too is that the person calling in has the power over how much information they release to the person they're talking to. So for example, if a family member is calling 988, that person is in control as to how much information they're going to share, if they're going to share their full name, if they're going to share their location, are they going to share their phone number. You can always call, and if you're having any trust issues as to if I call, they're going to come back and place me on 5150, then the person has a luxury to maybe not release all that information. If the only thing they need is maybe emotional support or
Yeah.
crisis services.
Yeah. That's a plus.
Mm-hmm.
Thank you.
Yeah, thank you. These are good questions.
I do have another question. When someone is calling 911 to access the care team, is it important that they mention that it's a mental health emergency, or is the person, the 911 operator able to, just know that they should contact you, or do you have to ask specifically for a mental health liaison when calling?
Officer Inland, you wanna answer that?
Yeah. I mean, it depends on the dispatcher's interpretation of the call, where they direct it. But for the most part, if you're asking for mental health assistance, they're going to direct that towards Raina and myself. But yeah.
That's great. Because I know that sometimes, in the moment, especially if someone doesn't maybe understand what a mental health emergency looks like, if they're able to describe what's happening, it's likely that you'll be brought in without them
Yeah, and
having to explicitly ask.
over the last 9 years, the dispatchers are getting used to it too, and the training is different for them as well. And they know that they can direct that person to this resource. So it's every day it's getting better in that regard.
Thank you.
And the same scenario may happen, or vice versa, I guess I should say, where it could be a person with a mental health condition, but not requesting a mental health service, right? Because we're going back to the first example that I believe Jean provided, where in their mind, the person calling it in their mind, they don't have a mental health condition. They need to file a police report. So the dispatcher's job is to get as much information as possible, and the caller is requesting to speak to an officer because they need to file a police report, not to speak to a mental health specialist. So it can go both ways.
And the dispatchers have access to a bunch of historical information regarding prior calls for service that they pull up really fast. So if they weren't familiar with that, they're trained to look at the prior calls and go, okay, maybe we should direct this call this way. And then the officers themselves, if they receive a call like that, they'll know, oh, this is a better fit for Raina and Trevor. So
I have another question then that what is the interaction between 988 and you guys? Do they know about you? So if they're talking to somebody that's in Watsonville, do they know how to handed off, or is it all separate?
I don't know if they actually know of us or me. I believe, I do know that they know that we exist, the mental health liaisons, that we exist. They've never reached out to us directly, but they do know that most, across the county, there's mental health liaisons operating along with law enforcement.
Yeah, I see that, you know, the Central Coast Suicide Prevention Service are the ones that take the 988 calls for our area. So it would be good if they knew when they could involve you guys, or if they, you know, just knew who you were.
Right, right.
Because what you have to offer is a wonderful thing. I just want to thank you. It's a very hard job, and I really want to thank you. What a service to the community you offer. It's incredible.
Thank you. Thank you. We both love our jobs, and yeah, I mean, it's a difficult job, but we both love what we do.
Absolutely.
We're just thankful that we're given that opportunity to do so. Any
Jen,
other questions?
your hand up.
I think
Jen,
she's
if
muted.
you're speaking, we can't hear you. I think you're on mute.
Thank you. If you're in the Santa Cruz Mountain area, like Bonnie Doon, what would it look like to make a phone call logistically? Would there not be a community officer available? And also the other question is, does the MERT and MERDI hours apply to the whole county or just South County? The new hours, the added hours?
Officer Inland, you want to take the first question and I'll take the second?
Yeah, so I'm not too familiar with that area, but I know that's in the sheriff's office jurisdiction. So they do have a liaison, but they're going to be working normal business hours for that resource.
And if there's no mental health liaison available at that time, oftentimes what the deputies will do is that they will reach out to the dispatcher to see if there's other mental health liaisons on duty working, to see if she can be borrowed and assist them with responding to that call. And I know it's happened, like just for example, earlier this week, Capitola Police Department, they have no mental health liaison. Earlier this week, they happened to have a call, and I was the mental health working at that time, and they reached out to me. And because I was available, I was able to drive out there and help them out with the call they were attending to. So that can definitely be an option. And then regarding your second question about the hours, that for the MERDI is across the county. I think that was the second question you were asking. Yeah, it's for all Santa Cruz County. And we have people, clinicians, mental health clinicians operating North County and South County so that the travel time is not too delayed.
Excuse
Did
me,
that answer your question?
how many MERT people are there?
Right now we have, I believe, 8 and 2 supervisors. But we are in the process of hiring more.
I'm kind of curious about what the process looks like when you are called, when you do go meet with a youth or an adult who needs support. and you are connecting them with resources, are you making those calls then? How are you, following up, making sure that the person is able to contact any resources that are necessary?
Yes, if during the crisis call, if the family or that individual is in a position, mental state to take those resources, I will definitely take advantage of that time and provide that information. If mentally they're just not in the right state, then most likely I'm going to follow up at a later time if they're okay with that. And that could either be in person, we follow up again a couple of days after, or I make that phone call and provide that information to make sure they take that information and hopes that they do follow through and that they do reach out to the resources.
And that won't just happen to calls that me and Raina respond to. Other officers will kind of refer people or provide Raina and myself with their contact information so that we could follow up with someone that maybe a graveyard officer spoke to.
Like, let's say an officer over the weekend, since I don't work weekends, responds to a mental health call and they feel that the person would benefit from maybe talking to myself, Officer Inland, that officer reaches out to us, whether if it's through text, email, gets us that information, and we reach out to that person again.
Thank you.
Well, these are great questions.
I have another one, Raina.
Go for it, Carol.
Does it make any difference whether you have private insurance or not?
In regards to our response, no. We respond to any call that comes in need of our assistance. For the crisis piece itself, as far as for ongoing long-term treatment and support, then I try to make it clear to that person that they do have to maybe follow back with their provider, with their insurance, to avoid having to pay out of pocket. But if it's a crisis and it comes in through dispatch, it's on us, and they should not be charged.
I have another question.
Mhm.
The situations and scenarios that have been presented, most of them, the person's clearly in harm's way, like suicidal. What if they are experiencing psychosis and instability, but they don't have a weapon and they're not a harm to themselves or suicidal, and they're not direct immediate threat? Then you can't call. Is that right? You're not to call. You really have to just wait until the shoe drops, is kind of what I've been told.
You can definitely call, but I guess it would depend on your expectation as to what you would like to see happening based on our response. So I'm gonna give a couple examples. Let's say all you want is for that loved one to get that emotional mental health support, not necessarily hoping that she or he gets placed on a 5150 and gets taken to the hospital. We would definitely be able to provide that and at that time and the moment. But if there's no specific means or justification to place this person on a 5150 hold that requires hospitalization, then that probably won't happen even if we respond. So there's just, the difference is meeting that criteria. We can respond, provide support, that clinical support, but not necessarily hospitalize this person if this person is not at risk of themselves or others. If all we see is this person has a mental health condition is experiencing psychosis, is displaying symptoms, but there's no specific safety concern, then all we're going to do is provide that clinical support.
So do you sometimes de-escalate situations, or do you think it escalates situations to have someone like yourselves or another resource come out?
Yeah, so a lot of the time it will depend on the person. Taking in consideration that if a call comes to me for me to respond, by default, I will have an officer with me. And oftentimes those are kind of the questions that I do ask if I get the opportunity to talk to the reporting party, the person calling in requesting that we respond, is how is your loved one going to respond once they see law enforcement in their house? Is that gonna trigger things, or is he or she gonna be okay with interacting with law enforcement? Because we do have to be realistic, right? Is our interaction absolutely necessary? If it's not, and we have the flexibility to maybe not interact with the person because we know for a fact it's gonna make it worse, then we need to take that in consideration. But the reporting party is in charge. If they say, nope, I want you guys to come out and try to assess and try to provide services, then we will come out. But there is that risk.
Thank you.
Does that make sense?
I think so. I think what's hard is knowing exactly when does the person qualify for the call, and they're sometimes difficult to know that specifically. Like am I feeling uncomfortable? Am I feeling, or am I clearly in a place of harm's way? So that's kind of hard to know sometimes.
Mm-hmm. Yes, and oftentimes the big question is my loved one at risk to hurt himself or others around him? It really boils down to that. Which it's unfortunate, really, because I don't feel it's fair that it should get to that point. But I'm just basing it on laws and 5150 criteria. Those are kind of our means to be able to say he or she meets criteria. We do have to hospitalize him and take him to the hospital now. He can't stay like this. If all we have is someone presenting symptomatic, maybe psychotic, delusional, that is not hurting himself or other people, then it makes it very difficult for us to hospitalize them because we don't have the grounds to do so.
Thank you.
Can I contribute here?
Thank you.
Was that Jen? In this situation, wouldn't it be good if Jen instead were to call the MERT team, the Mobile Emergency Response Team, to make a visit without law enforcement?
Yeah, if that person is has no access to any weapons, is not under the influence, the MERT team would definitely be an option.
Yeah, it might be just a moment that gives the loved one a connection with somebody who's not going to push anything, not going to push hospitalization, or is just going to make a friendly visit, say hello, and possibly tell the loved one about other resources.
Mm-hmm. Or check in regarding any possible medication that they should be taking that they haven't been taking, or encourage them to reconnect with their therapist, their psychiatrist, if they stopped for whatever reason.
Yeah.
It just depends on the need at that time.
have another question. You mentioned the program's been around 9 years or so. Are you aware, does the rest of the state have, other counties have such a good structure, or is this just Santa Cruz, or what's your sense of, did the state say, okay, something has to be invented, 9 years ago, or was this just local incentive that did that?
Yeah, I would say it was locally considered. I think now things are changing though, just because the need for mental health services coming in through law enforcement is so high. I think many law enforcement jurisdictions are realizing we need a mental health worker, either working for us through our department or collaborating, just like us collaborating with county mental health staff to work together and provide the service. Every county is different, but I know the state is pushing in more services just across the board because the need is just flat out high. Any other questions or scenarios?
If you don't have any, I have another question.
Yes, go for it.
How frustrating is it to you, the lack of mental health housing capacity? That's part one. And do you know how unhappy people are if they are in the CSP at the telecare unit with just that evaluation period possibly being, over 24 hours, and all they have is a chair to lay on, surrounded by scary people while they're in a psychosis. And it's really hard to not have a safe place to take people to or recommend that they go to. And also, I'm happy to hear that in 2025, there will maybe be a children's behavioral health unit by by the sheriff's office. But isn't it hard for you that there's so little housing, there's so little mental health capacity for people to live at and be given care?
Definitely, and I think not just specifically around housing or the CSP BHU unit that we have, I really feel that just across the county, we lack resources of all sorts, from housing to you name it. I mean, it would be a lot nicer if we had a lot more resources available to our community. I think, yeah, it's unfortunate. It's really unfortunate, and yes, very frustrating. And I don't know if it's because of funding. I don't know what's really the reason behind it, but I mean, I work for other counties, and other counties do have a lot of resources in place specifically for targeting available for the mental health population, people who are struggling with a mental health condition or a substance abuse, which I think they go hand in hand, those two conditions. But yeah, that's something that just across the board, we do lack resources, unfortunately.
That brings me to my other question. So many 19 to 25-year-olds, experience mental health crisis, and they're no longer a minor, so families can't get them help. And our county is not set up for that demographic. They go to, behavioral health on SoCal, and like you said, it's a dire situation there for support. So my last question would be, somebody goes to Dominican, and where can they be transferred to El Camino, or what does that look like? Where can they end up if they do need a longer stay?
Yeah, if they do continue to meet criteria after being at Dominican Hospital or even at Watsonville or at our local emergency rooms, The hospital, whether if it's the ER, the ERs pretty much, or even if they go to Dominican Hospital and then they get transferred to BHU, CSP, they determine based on placement where they get transferred to. And a lot of it is based on beds available. Unfortunately, we don't get to pick where they should go or where you would prefer for them to go. It really comes down to which psychiatric hospital has an available for this person at that time. And it can be from going all the way to Sacramento to the Bay Area. It just kind of varies on the beds.
Can I add something here?
Mm-hmm.
If you had a way to take especially someone, I think she said between 19 and 25, straight to CHOMP in Monterey, it's a lovely psychiatric facility, or to El Camino, I would try to make that happen.
Yes.
From ER to there, you know.
Yes.
But I wouldn't even, if you could go straight there, I think it'd be a better idea.
Yeah, and that's definitely always an option. If you are in a position to get your loved one in your vehicle and drive them there, that's always an option. And that's something that is always encouraged, because sometimes going with law enforcement, that can be traumatic too. But a lot of the times it happens because that loved one is not willing to go with the family member. Or they're just refusing to cooperate, or they're just in denial that they do have to go into a psych unit. So they're saying, no, I don't need to go anywhere. And it pushes that family member to call the police. And then the police pretty much has to force the person to go into the hospital. But
do the police have a choice of taking them to the CSP or to the emergency room?
So it's not a choice, it's based on the medical clearance.
Oh.
Because BHU CSP is only a psych hospital, not a medical hospital. If the person is in need of medical assistance, then the officer would have to take them first to an ER hospital before they can even be accepted into CSP BHU. For example, let's say your loved one has heart issues. BHU CSP will not admit that person without that person being checked medically to make sure that whatever heart issues he or she has are fully stable, that will not require any medical attention while they're at BHU CSP, because they don't have the medical providers to attend to that in the event that they do need that support.
What is CSP?
It's the Crisis Stabilization Center. It's our county psych unit off of Sept. Yeah, so that's what gets to kind of differentiate from taking the person to the ER or straight to our psych unit.
Yeah, in the psych unit, there is a crisis stabilization program, CSP. And that's where they do the evaluation about whether or not you're going to get to move into the actual hospital part of it and stay there, or whether they're going to evaluate you and send you to San Jose Behavioral Health, Fremont Hospital, Sacramento, wherever they can find a bed.
Or determine that you don't have to stay hospitalized and that person gets released.
Yeah.
Back home or to the street, or if they're homeless and they're stating that, yeah, if they don't have home but they live in the street, then they would get released back to the street.
All great questions and really great detailed answers from Raina and Trevor. We really, really appreciate you both being here and also the services that you do offer. We do have more time still if there are any additional questions. Otherwise, I want to, again, thank you both a lot for being here. It's really important that people know about these services so that they can access them. I feel like that's a huge hurdle for people calling 911 is that they don't sometimes know that there are people like Raina and Trevor who will respond to support their loved ones. So thank you so much for being here and sharing information about what you do.
Yes, and then even if you're ever unsure and you're maybe not ready to make that phone call for law enforcement to come out and do an assessment, know that you can always reach out to any of the mental health liaisons to get some kind of direction, support. If it's just questions, this is what's going on. Do you feel that I should make that call to law enforcement for them to come out? And just provide a little bit of detail as to what's going on. How is the person presenting? What is she or he saying? Have they been using? Have they been drinking? Are they isolating in the room? Are they refusing to go to school? Just so that you can maybe get a little bit of direction as to, is this a time that maybe I should be calling? Or maybe not. Maybe I should hold off. Because a lot of people do need that level of direction.
Thank you both. Thank you very much.
Thank you so much. Really.
You're welcome. Thank you guys for having
all
us.
that you do. It was wonderful.
Of course. And you guys can always reach out to me. Sophia, I think you have my desk number.
I do.
Feel free to share that with anybody. Any general questions, concerns, thoughts that come to mind, you can always reach out.
Thank you so much. I will be sure to add that contact information in the description of the recording when it's on our website.
Perfect.
Right? I hope
Thank you,
that,
Sophia. Thank you.
Thank you, Errol. Thank you for your great questions and Jean and
Yes.
everyone. Questions really, really great.
And if there's other questions that come up, because it never fails, questions come up after we have the chance to ask, feel free to reach out, email, phone, whatever feels comfortable to you, feel free to reach out.
Have a great evening.
Thank you so much.
Thank
Thank
you.
you.
Bye-bye.